Our drug class is monoamine oxidase inhibitors, also known as MAOIs. They are the first antidepressant ever developed. They work by preventing monoamine oxidase from removing neurotransmitters such as norepinephrine, serotonin, and dopamine from the brain. They make these neurotransmitters more available to affect the changes that are operational in depression. Some of the unlabeled use is to treat Parkinson's disease. The FDA recognized drugs are isocarboxazid, phenelzine, sedulene, and tranylcypromine. MOAIs are often tried with when other antidepressants do not work based on their severe side effects and safety concerns.
So one of the things we forgot to include when we were talking about MAOIs and their general restrictions is that there are some dietary restrictions. You can't eat food high in tyramine. Tyramine is an amino acid that helps regulate blood pressure. It occurs naturally in the body and is found in certain foods. If you take an MAOI and eat high tyramine foods, tyramine can quickly reach dangerous levels. And if this happens, you can cause a serious spike in blood pressure and require emergency treatment. Um, let's see here. Examples of food high in tyramine include strong or aged cheeses, cured meats, smoked or processed meats such as hot dogs, bologna, bacon, corned beef, or smoked fish, pickled or fermented foods such as sauerkraut, kimchi, caviar, tofu, or pickles, sauces such as soy sauce, shrimp sauce, fish sauce, miso, and teriyaki sauce, soybeans, snow peas, and fava beans, dried or overripe fruits such as raisins or prunes, meat tenderizers or meat prepared with tenderizers, yeast extract spreads, alcoholic beverages such as beer, especially tap or home brewed beer, red wine, sherry, and liqueurs, combination foods that contain any of the above ingredients, or improperly stored foods or spoiled foods. If you take any of these or eat any of these, it could cause a level spike in tyramine and there could be some blood pressure issues. Also, depending on the size of the patch used for selegiline MSAM, you may not have to follow some of these dietary restrictions, so just contact your healthcare provider and determine whether or not this needs to be implemented.
My name is Zach, and the drug that I was assigned to is called isocarboxazid, otherwise known as Marplan. The therapeutic class is antidepressants, along with the pharmacological class, which is monoamine oxidase inhibitors, and the drug is given in 10 milligram increments, and that's the only thing they offer by mouth. The treatment is used to treat depression, and as we said before in our introduction, that this is kind of the last stage of use before after you try other types of antidepressants because of the severe side effects of this. Its action is to inhibit monoamine oxidase to promote absorption of neurotransmitters, as we talked before, such as serotonin, dopamine, and norepinephrine. Its contradictions are some that you see in a lot of other types of drugs, which is seizure, ataxia, drowsiness, euphoria, orthostatic hypotension, renal and sexual dysfunctions, urinary retention, and also photosensitivity. And along with that, they urge you not to take it with other antidepressants, obviously, because the side effects could surmount and could come together and make the side effects obviously worse. Also, another thing that you don't use it with is dextromorphan, which is a decongestant because it can lead to psychosis. And also, a drug that we've talked about is busporin, and you're not supposed to take it within 10 days of using busporin. Another indication that you're not supposed to do is you're actually supposed to contact your healthcare provider if you have any upcoming procedures because you're supposed to discontinue the drug 2 weeks beforehand. Nursing implications are fairly simple, which is assess renal function, obviously, because it could cause urinary retention. Monitor their blood pressure because their blood pressure could go all over the place because it has different effects on the body. Could go high, could go low, so you want to keep an eye on that. You want to monitor intake and output because it's been known to link to weight loss. Also, it's been known to link to different types of retention, so you want to pay attention to that. Make sure their output is greater than the input. Do not use at night is a big one because it could cause things such as insomnia, could wake up restless leg syndrome is one of them that has been an indication with this drug. Also, as you know, you should report any suicidal ideations, and the nurse should tell the client to pay attention to any lowered or raise the anxiety levels, because anxiety goes hand in hand with depression. So if it lowers, the nurse wants to know because the drug is working, and if it doesn't, then if it raises, then the drug is not working. It's time to try something else. The other thing is you're not supposed to use it with any alcohol. You're not supposed to drink coffee with it much, and you're not supposed to use it with any other CNS depressants.
One of the other drugs that we had was phenelzine, also known as Nardol. Its therapeutic class is an antidepressant. The pharmacological class is a monoamine oxidase inhibitor. It's only given in a 15 milligram tablet form. It's used to treat patients with neurotic or atypical depression. Its action, it inhibits monoamine oxidase to promote absorption of neurotransmitters such as serotonin, dopamine, and norepinephrine. Contraindications are patients with hypersensitivity, liver disease, severe renal disease, heart failure, or any concurrent use with other antidepressants. Some of the side effects include, but not limited to, dizziness, seizures, fatigue, insomnia, tremor, orthostatic hypotension, weight gain, and urinary retention. Nursing implications: assess mental status, mood changes, and anxiety levels frequently, especially during the when you first begin to use this drug. Monitor the blood pressure, monitor input and output, and do not administer at night because it does, one of the side effects is insomnia, and it also have other sleep disturbances. The desired outcomes are improved mood, decreased anxiety, increased appetite, improved energy level, improved sleep, and the patient may require 3 to 6 weeks before this drug starts to work.
All right, another drug we were assigned was selegiline transdermal, also known as Emzam. The therapeutic class is antidepressants. Pharmacological class, monoamine oxidase type B inhibitor. It's used to treat major depressive disorder. The action is, following conversion by MAO to its active form, selegiline inactivates MAO by irreversibly binding to it at type B brain sites. Results in higher levels of neurotransmitters such as norepinephrine, dopamine, and serotonin. The contraindications are hypersensitivity, liver disease, severe renal disease, heart failure, and you're not supposed to use it with any other antidepressants because it could make the side effects worse. Some of the side effects include serotonin syndrome, insomnia, abnormal thinking, tinnitus, hypertensive crisis, orthostatic hypotension, peripheral edema, anorexia, weight gain, urinary retention, and sexual dysfunction. Nursing implications include you need to assess their mental status, mood changes, and anxiety levels frequently. If they're changing too much, you need to do something about whether or not giving them the drug or taking them off of it. Monitor their BP, their intake and output, and don't give them at night because it has insomnia and they might not be able to sleep. And the desired outcomes would be improved mood, decreased anxiety, increased appetite, improved energy level, improved sleep, and the patient may require a 3 to 6 week period before they see any kind of improvement. And the last drug we had was tranylcypromine, also known as Parnate. The therapeutic class is antidepressant, and the pharmacological class is monoamine oxidase inhibitors. It's used to treat major depressive episodes without melancholia. The action is that it inhibits the enzyme monoamine oxidase, resulting in an accumulation of various neurotransmitters such as serotonin, dopamine, and norepinephrine. The contraindications include hypersensitivity, liver disease, severe renal disease, heart failure, concurrent use with other antidepressants. If you use it with other antidepressants, it could worsen the side effects. The side effects include seizures, confusion, dizziness, drowsiness, headache, insomnia, restlessness, tremors, sexual dysfunction, and urinary retention, among many others. The nursing implications include assessing mental status, mood changes, and anxiety levels frequently, monitoring BP, monitoring intake and output, and do not administer at night because one of the side effects can be insomnia. And then the outcomes are, or desired outcomes are, improved mood, decreased anxiety, increased appetite, improved energy level, improved sleep, and you might have to wait 3 to 6 weeks to see any kind of improvement in the patient.